As COVID-19 cases surge across the country, advisors for President-elect Joe Biden are scheduled to meet with COVID-19 vaccine makers this week.
And vaccine companies are hopeful that things will return back to normal next winter. There are 2 vaccines now showing that they're effective. Quicker, more accessible testing is key to controlling the virus until those vaccines are ready. At-home tests meant to do that are on the sidelines right now. Wink News medical reporter Veronica Marshall explains why they haven't been approved.
More than 100,000 new coronavirus cases a day and climbing.
We've essentially allowed this virus to get so far out of control that we are now going to start seeing lockdowns.
But Dr. Michael Minna says we can bring our numbers down without such devastating measures. All we have to do is put the public back in public health and let people screen themselves.
Getting antigen tests into their homes and allowing them to use that information to just know their status and then make good choices.
The Harvard researcher says the strategy is cheap, effective, and convenient.
Give it to them so that they can brush their teeth and then take a COVID test twice every week.
But not everyone is convinced. Dr. John Brooks with the CDC says it's an innovative idea, but
we'd like to have some more research around what their intentions are and then what they actually do when they engage in that kind of testing.
Another hurdle, the FDA.
There's a lot of companies who are building the tools and building the manufacturing capacity to potentially do this, but we continue to see no progress at the level of the FDA.
In a statement, the FDA acknowledges that testing outside of healthcare settings is crucial to fighting the pandemic. The agency is working with developers on those tests, but none have been authorized yet.
We need to have the FDA change its authorization pathways to allow the companies that are making these potential public health tools that can sit in people's homes to allow them to get through
the regulatory process and into our homes. Dr. Minna says even if half of the people who take their at-home rapid tests ignore the results, even if they're positive, the plan could still work. Meanwhile, if you'd like to read the FDA's full statement, open the Wink News app and click on this story. In the newsroom, Veronica Marshall, Wink News Now.